All right. It's 12:01, so we're just waiting for people to keep coming in, but we're excited to get started soon. Just a few housekeeping rules as you're coming in. Make sure you're muted so that we're not getting a lot of background noise. And feel free to come off mute if you have a question or a comment. And you can definitely make use of the chat as well if you want to ask a question or make a comment. So those are the tools you have available to you. And we'll get started in just a second.
Does the screen look okay? Is it taking up the full? Okay, awesome.
Yeah. Okay, maybe we can get started then. Hello, everybody. You are in the street medicine training. If this is where you're supposed to be, great. If not, let us know and we can figure out where you need to be. But welcome. We're so happy you could join us here on a Friday. It's fantastic to see everybody. And without further ado, we will get started. Next slide, please. All right, so I see some of you have maybe already started doing so, but please in the chat, put your name, your preferred pronouns, maybe the organization you're here representing, and then let us know if your community has a street medicine team, and if so, what organization do they partner with? Or do they partner with your organization is maybe a better way to ask that question. But yeah, let us know, and we're excited to see your responses in the chat. Okay, while y'all are doing that, we will continue. Next slide, please. Okay, so before we talk about street medicine, it's kind of important to talk about the context where street medicine emerges from and kind of the realities that folks are facing when they're experiencing unsheltered homelessness. So unfortunately, we all know that there's a very direct link for facing unsheltered homelessness with a greater risk of poor health. We know that and people have more and more of a chance of getting communicable diseases and more of a chance of falling sick with infections. Uh, Unsheltered homelessness exposes people to conditions such as extreme weather, malnutrition, and extreme stress by the situations they're in that can really add on to the deterioration of a person's health. We see and we know that there are really high rates of infectious and acute illnesses, things like skin diseases, TB, pneumonia. Chronic diseases are hard to manage when you're experiencing homelessness. So things like diabetes or hypertension are all things that can really kind of chip away at the way you're feeling when you're outside. Poor mental health, substance abuse are also common things that can be really exacerbated by a person's conditions while living outside. And we know that sometimes the mortality rate for people who are experiencing unsheltered homelessness can be as high as 3 to 4 times higher than the general population. So that is decidedly aggressively higher than the norm. And we know that people age at a much higher rate that leads to them having an accelerated rate of problems, and with that comes a whole host of complications and issues that can really affect a person's quality of life. Next slide, please. So that isn't compounded by the lack of healthcare or lack of access to healthcare. So healthcare is difficult for most of us to access, and in this country, it's kind of a complicated system to kind of get to know and be familiar with and get comfortable with. But if you're experiencing homelessness, you're often that's compounded even more so. You're often unable to access healthcare, even if you have insurance, because a lot of people don't have the right information and resources of what is available to them. A lot of times if they have the information, they might not have a way to access it. They might have transportation issues. They might be, there might be huge wait times that are really hard to kind of work with folks who are experiencing unsheltered homelessness. There might be a lot of issues with communicating well with providers or providers understanding where a person's issues and experiences are coming from. And of course, like most things, you need an address or an email address to kind of document things that are happening in your healthcare, or get communication about appointments or when to show up. And that's really hard to manage when you don't have an address or you don't have an email address. So all these things are exacerbated already by terrible conditions of living outside. And then when you compound lack of access to healthcare, it just makes a already bad situation much worse. Next slide. And then when you think about, people who might be connected to the homeless system of care, it's important to understand that homeless systems of care are often not very particularly well connected themselves to the health system. So they might just be, siloed off. So they might be connected to one thing, but they might not really know how to connect folks to the right resource for healthcare. And so there might be, gaps in people's knowledge about a person's health history and the health needs that are coming up for them. And because of that, people might not even be connected to the right health resources if they're being connected at all. Um, and people who are experiencing homelessness, especially people who are unsheltered, are not consistently enrolled in benefits often, and they're not consistently engaged with when it comes to their healthcare resources. So there's a significant lack of trust when it comes to, talking to people about their health histories and talking to healthcare providers, because they've often had terrible experiences that kind of justified them feeling that way, right? And so without healthcare, we also know it's really challenging for folks to be able to get stable, achieve stable housing. So it's kind of a vicious cycle that all really feeds into each other. Next slide, please. So I say all of this, and it's really doom and gloom, but I say all of this to kind of really inform the context of where street medicine is born out of, and what street medicine hopes to do. So it's really a system or a program that hopes to be responsive to kind of all the challenges I listed out, and be able to kind of get to the underlying issues and concerns that come up when trying to provide treatment for folks experiencing unsheltered homelessness. Next slide, please. Okay, so what is street medicine? And the few points that we have listed on this slide are by no means an all-encompassing definition, but they're definitely the integral, the tenets, the basic tenets of what we can take away with understanding what street medicine is. And it really boils down to delivering medical care to people where they're at, right? And so this could mean, meeting people where they're at outdoors, in their cars, in their encampments, and really providing medical care right then and there, and not really kind of requiring them to come into your space or come into your office or come to you for a follow-up that way. And it's sometimes called backpack medicine for the same reason. And it really helps people connect to primary care and other medical and behavioral health services on the ground as needed. And then it can really help to build that relationship and rapport to also get people connected to housing resources as well. And like I said, it's really helpful in building that trust and rapport. And it really helps in getting that relationship building process a long way. And it really allows people to address a lot of the healthcare concerns that people have in real time. And, once people are sometimes housed or in a more stable environment, street medicine can continue to provide that care to really make sure that there is a smooth transition as they're kind of adapting to a new environment. Right, please. So there is a wide array of models of what street medicine programs can look like. The California Health Foundation funded a landscape survey, which I believe was done by USC, and they really tried to document and capture what is going on in street medicine in California specifically. And so the kind of landscape that came out of that is not necessarily exhaustive, but it's really useful to get a feel for what street medicine can look like at different levels. And obviously there's things outside of what came out of the landscape. So maybe programs that are outside of California, or maybe things that programs are doing that don't maybe necessarily meet the parameters of street medicine, but they might call themselves street medicine, versus other programs that might be doing street medicine, but maybe not calling themselves that. So it's a mixed bag, but I think what it gives us is really an idea that it can range from small to large, and many of the programs are usually embedded or in partner with different organizations. So this can include things like nonprofits, hospitals, the academic institutions, government agencies, and then a few of them can also operate on their own. So it's kind of a range there. And then the teams are made up of all sorts of different multidisciplinary teams. So most teams will have some kind of combination of like having a physician or having someone who can do diagnoses and write prescriptions, but then also have like psychiatrists and advanced practice providers, medical assistants, counselors for drug and alcohol use, community health workers, and even volunteers. And I think the one constant we constantly see though is that they will definitely have some kind of like I said, physician or a person that can diagnose and write prescriptions. And I think that one of the surprising things that came out of this was that it's rare to see just to have like one fully dedicated full-time person. And so usually it's people who are kind of working in different capacities coming together to make one big full-time team, if that makes sense. And then we often see that there's a combination of rounds and outreach to find new patients. So, people will go out there to connect with new people, to see old patients and do it on a really consistent basis. So if you and I go to the doctor once a year, that doesn't mean that necessarily translates into how street medicine works. It's a lot more active engagement. They're coming out over and over again to really be able to provide the continuity of care, to really be able to build that rapport, that support, that trust, and also be able to kind of be responsive to people's medical needs in very real time. And then smaller panel sizes are usually common as compared to traditional settings, and that's just due to how much time an interaction can take when people are out there providing healthcare to people. Next slide, please. Okay, so in terms of talking about all these different programs, we thought it might be helpful to give like concrete examples of two programs that in this case are outside of California. So these two programs kind of speak to what street medicine can look like, right? And so the first one is the Operation Safety Net in Pittsburgh. It was created out of the original concept of street medicine back in the 90s. And so its outreach team includes a outreach specialist, a clinical volunteer, medical students, non-clinical support staff, and folks that can provide social services. And the team makes street rounds that will do drop-ins at shelters and other community centers, and they will come by at community events so they can build that relationship and rapport with people at all these different access points. And then the team offers, everything from basic medical care and over-the-counter medications to antibiotics. And it can even help manage chronic health problems such as diabetes or other things. And often they're also able to provide referrals to the healthcare system and link people to the COC's coordinated entry system. So that is one kind of example of what it can look like. And then the other we have is the Mercy Care System in Atlanta. And this is a program that's kind of embedded with a partner organization at the Emory Morehouse School of Medicine. And so they deploy a multidisciplinary team that has healthcare providers, and they do this 4 days a week. And sometimes they'll have a psychiatrist or medical students that will go out as well. And their team kind of focuses on treating minor ailments and chronic conditions, in addition to providing referrals to social services and helping people find, employment and things like that. Next slide, please. Okay, so those are two examples that we gave outside of California. And then kind of coming back to the California context, the two programs we have here are also a good way to kind of understand the range of what street medicine programs can look like. So the first one is the USC Keck School of Medicine program in LA. And this is a really robust program. And they might be a bit of an outlier in terms of how robust they are and the capacity that they can serve folks. They do have a dedicated full-time team. So that is definitely an outlier. And, LA, I think, has the most concentration of street medicine programs, which would make sense given the number of people who are unsheltered there and the size of the city. So this program definitely aims to be responsive to the community that they're in. And they meet most of the patients through direct outreach and encampments and sidewalks in LA, but they also accept referrals from the community, and they also accept self-referrals. And they also offer primary care, wound care, medication management, and specialized services. So that could look like all sorts of things, like PT and that kind of stuff. The second program is the Hope Shasta Community Program in Redding and Shasta County. And this is a relatively smaller program when you compare that to the USC program, right? And this is, it operates in a bit more in a rural area. So their operational logistics are a little different. They serve a community that's 100K people. They have a lot of green space. They have a lot of canyons and rivers running through the town. So their approach is to really park and hike out and meet people along the trails in the river, right? And so this kind of really shows that there's no one way to be a street medicine program. It really helps to kind of understand your community and adapt to the way the community tells you they need help and need care. And the Shasta program also has a mobile medical van equipped with a lab area. They have an intake waiting area, they have exam rooms, and they've really established a community setting 3 days a week so people know that they'll be there. And then once a week, the outreach team also sees patients at a hospital-funded medical respite site. Next slide, please. Okay, so we talked about 4 different programs, and 2 of them in California, 2 of them outside, and we kind of highlighted the different things that they do and the things they do well and similarly. And in kind of going over that overview, we really want to highlight that there's no one really one way to do something right. And so there's no one best practice, there's no one strategy for success, but it's really ensuring that you have a model that's responsive to what you're seeing in the community. And we kind of summarize some of the strategies we've seen so far that can result in positive outcomes. So, you know, understanding your geography, your terrain, the available resources you have, really understanding the specific needs of the unsheltered people in each community will also dictate what really works best for that community. Building trust, I've said this, but over and over again, building trust is really important because that is the only way you're able to build rapport and get people to come and talk to you and able to help you help them. And so that requires meeting people where they're at, realizing that people's lived realities are very different than any other healthcare setting that you would have patients in. And when you're doing anything from, talking to them about their medical history or prescribing medications, it's really important to kind of center a person's lived reality, daily lived reality at that, into the things that you're prescribing them. So if there's a medication that really, requires a person to use the bathroom a lot more or makes them drowsy, those are all things that really need to be considered because a person may not have access to the bathroom or, may not feel safe falling asleep in wherever they're at. So making sure that the treatment that you're coming up with is really helpful and responsive to them is truly meeting people where they're at. And also considering a person's just physical environment and, taking assessing what would be helpful to them in their daily lives. Additionally, there is a house beds tool that I believe the USC program uses, and I think it's a clickable link in the slide. So when we share them out, you should be able to check it out. But it's basically a tool that takes a person's comprehensive history, including their social history. So if maybe for a person experiencing unsheltered homelessness, you can really get information around like how many meals they're eating, do they have access to bathrooms, what their day-to-day living looks like, so that a treatment plan can be created really with those responses in mind. Outside of that, thinking about getting to know the lifeguards in your communities. This can be people who would notice what's happening around them. This can be people in the community that would know your patient really well or would know what's going on with your patient, so that if a street medicine team is, at the encampment or outdoors and they're there for an appointment, they're there to drop off prescriptions and they can't find the person, there are other people in the community who can kind of communicate where they're at or what's going on with them, so that you're able to kind of keep track of what's happening and really be able to provide that continuity of care. Additionally, just kind of really making sure the established connections in the community. This also goes a long way for the safety of the street medicine outreach teams. Just really knowing what's a good time to go, what's a bad time to go, what would be helpful for the community that you're going into, what would be responsive to the needs that they're describing, are all very good strategies to kind of really continue building that rapport and that trust. And helping people make those connections to mainstream healthcare is also really important, so that people are able to stabilize and do well in the long term. I think that's my last slide, and I will hand it off to Carla.
Thanks, Sarah. And bear with me, y'all, because I have a little bit of a cold, so I might have to mute myself to cough or sneeze, or might talk a little bit lower than my normal voice. But so yeah, now we're going to kind of talk about zooming out, street medicine's kind of role in healthcare, in the landscape, right? So street medicine, in the past, especially, has been often considered to be simply filling in gaps in the system. Um, but now a lot of people are recognizing that for a lot of people who are experiencing homelessness, particularly unsheltered homelessness, that sometimes street medicine is the only way that that person is receiving primary care. So that's just kind of like the care that you and I would receive once a year in a clinic, like that kind of basic care, right? To make sure everything's going okay with your health and all of that. Um, and so there's been that recognition of like, wow, street medicine is really like playing that really important role in a lot of people's lives. And at the same time, there are people who are a little bit cautious with calling street medicine primary care, just because of this fear that, doing so could end up creating like a separate but sort of lesser system for folks, just because our current healthcare system is really not set up well to serve folks. So just wanted to kind of note that when we're talking about street medicine in the healthcare landscape. And then sort of to differentiate between like street medicine and maybe like health focused outreach, which is what a lot of your programs are doing or providing. Street medicine is a little bit different because it provides the services, the diagnoses, and prescribes medications in that very moment when they're having that interaction with a person, versus referring them or giving them information and then they have to go somewhere else to get that care. So they're really getting that care right in that moment. Um, Street medicine often serves patients who don't have insurance. A lot of them are embedded within or connected to the federally qualified health clinics, which then allows their teams to provide care to uninsured individuals. So those folks, are often served by street medicine. And then, of course, street medicine plays a critical health in public health, right? And so the prevention of the spread of infectious diseases, and also just like providing that preventative care for those infectious diseases and providing information about it as well, which is something that you all do in your health focused outreach. So that's something that your health focused outreach has in common with street medicine. So there have been some recent developments that are relevant to street medicine. The first one, which is a really big deal for street medicine and has been the focus of the Street Medicine Institute's lobbying efforts to get this passed, is the new place of service code, which makes it, which is specifically for people getting medical care on the street versus like in a clinic or other locations. And our next slide goes into a little bit more detail, but essentially, this new place of service code makes it easier for street medicine programs to actually be able to bill Medicaid for providing medical care to people out on the street. And then also of note, in California, as of late 2022, street medicine providers can bill Medi-Cal without being a part of a physical location, which did not used to be the case. It used to be that the physician had to have a connection to a brick and mortar site. And so this is a way to make it easier in California for street medicine providers to both exist and provide medicine and be reimbursed by Medi-Cal, which is a big deal. And then in the last bullet, enhanced care management and community health worker Medi-Cal benefits. We can talk more about those if folks have some more questions about those programs, but essentially those are Medi-Cal programs specific to California, which enhanced care managers and community health workers can really be critical parts of a street medicine team. So street medicine teams, if they have those folks on their teams, they can partially at least pay for some of that work via Medi-Cal by billing Medi-Cal. So that's really great. So going into a little bit more detail about this place of service code that I referred to in the last slide, there's a couple reasons that having this code for street medicine is really historic. So number one, it means that now street medicine is recognized nationwide as a part of the healthcare system. So it really legitimizes street medicine. It also acknowledges that street medicine visits, as opposed to like mobile, like kind of distinguishes street medicine as its own thing versus like mobile medical vans and other healthcare that are specifically targeted for folks who are experiencing homelessness. It makes it clear, that street medicine is literally you are going where the person is, and that it's a unique service. And what happens is it allows street medicine programs to really negotiate rates with health plans that are specific to street medicine, right? Acknowledging that it takes a lot more time in street medicine, and there's some differences because you're meeting somebody directly where they are versus having them come to you. And then it also allows for the ability to actually collect better data. So lots of like cool impacts on having this new nationwide service code for street medicine. So here's some, this slide goes over some funding sources for street medicine programs. So this training and like this slide, it's not intended for you all to be like, how to start your own street medicine program or anything like that. But we wanted to sort of just talk a little bit about the ways that street medicine programs are funded, because it does kind of, funding is always something that you all are worried about and that other folks who are doing this work have to worry about, right? So some potential funding sources for street medicine programs includes Medicaid, which of course there's going to vary state by state, but California has its own rules. The Mobile Healthcare Act, which provides new access point grants for the federally qualified health clinics. So this federal grant, it's not guaranteed and it doesn't happen every year. It's not available every year. But when these do come available, there's sometimes a way to fund a mobile healthcare for folks experiencing homelessness, which can then include street medicine, going out from a mobile van and then doing street medicine. Federally qualified health clinics can often build into their budgets, either supporting street medicine program or fully funding it. Medical schools can provide staffing for them at the very least, like medical students or residents. And then especially in California, we're seeing in the Homeless and Housing Incentive Program, also called HHIP, one of the big focuses of that program was to create and to fund street medicine programs or expand new ones. And a lot of health plans throughout California really did do that. So that's been like another source of funding that's relatively new. And then, of course, philanthropy and grants can also fund street medicine programs. So Sarah touched on this a little bit, but we're going to talk in the next few slides about things that are not quite street medicine, but similar to street medicine, are intended to get care to people without having them go to standard clinics or to hospitals. And so first we wanted to differentiate between mobile medicine and street medicine. And some folks talk about both of these interchangeably, which makes a lot of sense because it's bottom line is that you're bringing medical care to folks who are unsheltered. But the difference is that mobile medicine, when you have a mobile unit, right, it still requires people to leave their exact location, to leave their possessions behind and enter a space that looks a lot like a clinic and enter your space, right? And so it's it's still a really important way to deliver care to folks, but it is very distinct from street medicine in that way that, street medicine does not require a person to leave their belongings, leave where they're living to get that care. So the next few slides are just some ways, that we tend to share with communities to think about how to get better at delivering care directly to folks who are living unsheltered. So even if you don't have a street medicine team in your community who you can partner with or be involved with, getting health providers to join your street medicine teams is a way, street outreach teams is a way to, get folks who are unsheltered connected to healthcare services. So, doctors are wonderful, but they're not the only providers, right? There's other types of medical providers who can come, who can provide and prescribe care for folks. Medical and nursing schools and teaching hospitals are, a lot of the times interested in being partners in this. And then enhanced care managers and community health workers might also be good options of health system partners to include in your outreach. And some of you already have, community health workers in your organization, and some of your health ambassadors, are either becoming certified to become community health workers, or going to do that in the future. So really great partnership there. And then some additional strategies to improve the connection for unsheltered people to get more health care. So first, like working with local providers to set aside specific days and blocks of time where encampment residents can walk in without appointments. So essentially, that is all about lessening the barriers that a person who is facing unsheltered homelessness may face when they're creating appointments, right? And also to avoid having folks have to get medical care when they're in the emergency department versus like preventative care and primary care, right? Another strategy is to partner with pharmacies to help folks simplify the process, helping, pick up medications and delivering those medications. I know some of your organizations during the Health Ambassador Program have, talked with your local pharmacies about partnering together to provide vaccinations and other things. So this is like a strategy that you all, have been familiar with. Another strategy is accompanying folks to health appointments, right? So for people who do need to go to the traditional brick and mortar settings, like let's say, somebody needs to see a specialist and there's no way to get that person out there. Oftentimes like outreach workers and peer specialists will actually accompany folks to those appointments to just help them advocate for their own health, take notes, ask the right questions. It's difficult for any of us to really understand and track what a doctor is saying. And so having that support there is super helpful for folks and can really improve, the experience that they have attending a brick and mortar, healthcare service, but also can really improve the quality of care that they receive as well. All right. I know Sarah and I talked very fast and we covered a lot. The next slide after this is just like a resources and further learnings that has different links to some of the resources that we referred to. And we're also going to be sharing a PDF version of this slide deck so that you can click on the different links that are kind of throughout the slides, but we wanted to just kind of open it up for folks to share questions, any ideas that you've had. What else do you want to know? What street medicine programs do you know of? Is there a street medicine program in your community? Do you already partner with them, or do you want to partner with them? We'd love to hear it all, and feel free to come off of mute or type in the chat. We'd love to hear from you.
No questions in the chat just yet, Carla and Sarah, but we'll see if anyone puts anything in there.
Thank you. I know it's Friday afternoon or Friday morning, sorry, for a lot of folks, so. I'm going to stop sharing so we can all see each other's faces. You folks have any questions? What was I guess I'm curious to know too, what motivated folks to come to today's training to hear more about street medicine programs? Is it something that you are familiar with as a model of care? Is it something that you're just finding out for the first time? Be really curious to know that.
Oh, okay, good. My camera is working. Good morning, everyone. I am interested in the medicine because I know sometimes when you talk to people about the COVID, they ask about like, well, what if we get sick even from the vaccination? Like, what can we do to, help us up, especially if we're homeless? So I think it's really good to know about this medicine, how we can make it available to them. And if we are able to, even go out there with the medicine to give it to the people that maybe are already sick, that, especially if they've already gotten vaccinated and they get a little irritated when they do get sick. So it's good to go out there and let them know that, if you do get sick, which people still, get sick even with other types of vaccinations, at least this medicine will help you, with the symptoms and for it not to last as long. Oh, that's all.
Jillian, were you going to say something?
Oh, I was just gonna say thanks to Angela for sharing that, and also just wanted to like make sure we're clear about like the that some medications, if they're prescription medications, like outreach teams or health ambassadors, for example, might not be able to actually like deliver that specifically. And so I think that's one of the reasons we wanted to make sure folks are aware that like your community might have a street medicine team or might just be able to like partner with a pharmacist or a medical or like a provider that could like come out with you to help do exactly what you're talking about, Angela, which is like actually be able to provide medicine that folks need where they are.
Thanks, Jillian, and thanks, Angela, for sharing that, for asking that question. And then James wrote in the chat, are there other programs in California that are offering street medicine other than the two that were listed in the presentation? Absolutely, there are. Those were just two that we wanted to show like an example of a really robust one, and then a smaller street medicine program to really show the range and size, and also like the number of people that they can serve and the differences in composition. But actually, I wonder, Jillian, there's that map, right, in the one of the web pages. I don't know if it's for the, I don't
In
know
the
if it's
landscape?
the survey. Yeah, but maybe we can just pop that link. Is it in the landscape survey itself?
Let me double check. I'm going to repaste.
Okay.
I just repasted, James, the California Healthcare Foundation, the website that has the landscape. But also just want to, I mean, Carla mentioned this already, or Sarah, or both of them mentioned the landscape doesn't have literally every single street medicine program. So if you're looking for one in your community, honestly, you could Google like your community's name plus street medicine to see if there's one. If you don't see one in the landscape, for example, there could still be, or you can connect with other resources. But that page, and I'll look and see if there's a map, and if there is, I'll come back and let y'all know in the chat.
Yeah, and I know in one of our health ambassador calls, someone had shared that they had attended the street medicine workshops that we've been sending to the health ambassadors. And they had asked like if there was a street medicine team in their community. And it looked like there was one in basically the neighboring county, but their actual community had street focus, like medical focused outreach, which like we said is a little bit different in the sense that maybe folks are not prescribing and providing medical care right in that moment, but they're instead like referring someone to care or providing information about healthcare services. So it's very possible that your community also has that too, and that might come up if you do search your county and street medicine program, that might come up, and it might not look necessarily like maybe some of the street medicine programs that we've been talking about, but still a great partner that, you can explore partnerships with and, maybe have some folks join your outreach too for your organization. Yeah, so Jillian noted that there is a map in the landscape, and I think the Street Medicine Institute might have a map too, but I can't remember. But yeah, James, let us know if you find anything. Curious if your community has one. Jasmine wrote, I'm part of AYC, so Asian, is it Youth Center? I can't remember. And have
Yes,
joined
it's Youth Center.
Youth Center. Thank you, Jasmine. And have joined a street medicine meeting before and enjoy attending because I love. Could you speak a little bit more, Jasmine, to what that street is? Is it like a meeting that your street medicine team puts on to connect with like local providers like AYC or?
I believe that it was through LASA. I don't quite remember who it was through, but yeah, they just gave us like it was so much information and so many resources. Well, more so with other health ambassadors and other organizations that were in the group. They were sharing their resources, so it was just really nice to be able to receive more information to give to our clients while we did outreach.
Yeah, absolutely. And LA has, I think, the largest number of street medicine programs, which, LA also has, some of the highest numbers of folks who are unsheltered too. So it's great that they have like lots of street medicine programs too. So that's really cool that they had that like kind of peer sharing meeting to share what the work that's going on. And then Randy said, I'm here as a current health ambassador to gather information and contacts that otherwise would not be my primary concern to enhance further employment opportunities within Lifelong's program. Yeah, thanks, Randy, so much. I'm curious, have any other folks partnered with street medicine programs? Know of street medicine programs in your communities? Have any questions about any of the content that we provided as well? And I will say too, like just kind of speaking to what Randy said, the roles that you all have that, the health ambassadors in particular have had during this program are extremely translatable to the work that street medicine programs do. And, a lot of street medicine programs have, like we said, community health workers, peer support folks, essentially folks that are playing very similar roles to your health ambassador role. So it could also, like Randy said, be an opportunity for health ambassadors to see if there is a program, in your area that is looking for folks to fill those positions and be extra support on the street medicine programs as well. So. Well, do folks have any other questions or want to talk through anything that we shared that you're curious about? I know we kind of threw a lot of information out there.
I just want to know while we're giving folks time to ask any more questions or say anything else that I put this in the chat, but just for anyone who's not looking at that or for maybe people watching the recording, I just want to emphasize that the street medicine landscape that USC conducted in partnership with California Healthcare Foundation, I think it names 25 street medicine programs around the state, but even since they have posted that, USC has even noted, I think USC has a street medicine page, webpage that you can go to that we probably link to somewhere you can find it pretty easily, that there have been they have identified since even publishing the report, like multiple more street medicine programs. So I just wanted to really emphasize that not only was that landscape looking at particular types of street medicine programs, so it wasn't even comprehensive as of the time. Like, it's very helpful and it's still worth looking at, but it wasn't meant to be like a comprehensive list of every single street medicine program existing in California at the time. But that in addition to that, like since then, there are new programs or expanded programs for a lot of the reasons that Carla and Sarah have shared during the presentation. And so really don't see that in landscape, see 25 and think there's only 25 programs in the country, in the state.
Well, if there's no additional questions or any thoughts that folks have, thank you so much for joining. We do have 2 more trainings that we're going to be providing. So as part of this training series for y'all before the end of the grant program. So the next one is on Wednesday, April 3rd from 10 to 11, and it's going to be about harm reduction and housing first. And then the next one is the next day, Thursday, April 4th at the same time, 10 to 11. And this one's going to be about sustainability planning, which I know is a topic that we've been talking about a lot, especially as the grant program sort of wraps up. And as always, we are always available if you need any support or help with your programs or want to talk. And so please feel free to reach out to us at Health Ambassador TA at homebasedccc.org. Thank you, Jillian. She posted it, the email address in the chat. But otherwise, looking forward to seeing you all in our next few trainings and hope you all have weekends that are restful and everything that you all need. So thank you so much.
Thank you.